Better relationships, the sharing of information, and saying to patients, you're the expert in your own life, how can we help you? All these ideas are at the heart of Leeds Clinical Commissioning Group's continuing mission to develop good communities of practice. Catherine Jacobs sent this report from Leeds on the clinicians who are leading these improvements and investing in digital and technology to support people in managing their own health.
Putting the patient at the centre of everything to provide the health service they say they need. That's the key goal of NHS Leeds CCG, and this learning cafe in Crossgates is an excellent example. It's part of the Live Well Leeds initiative, which targeted 600 vulnerable or chronically ill patients in 2 communities to ask them what really matters. The results have been life-changing.
I'd not been out for nearly 5 years, and then they introduced me to this place because I was depressed, and I don't know what I'd do if it wasn't here now.
I suffer from depression, and a nurse came to me from here to tempt me out, and ever since then it's been marvellous.
Here at the Live Well Leeds Learning Cafe, people can come from the local community, talk about all kinds of things, from loneliness to mental health, pain relief, to how to manage diabetes, getting support and advice from fellow sufferers, and also from healthcare professionals about how to live well and healthfully.
Care matron Louisa Maven has been a driving force and says both patients and staff have benefited.
Health isn't just about physical illnesses, it's about everything around people. It's about their mental health, their physical health, their social environment, their community. And it's given us a chance to look at all of that, to look at the person and to design the systems around that person. So it's been hugely rewarding for them and for the staff as well.
What I really like that is new on the MyMate website is the blog section.
From one generation to another, Leeds CCG has also been working with young people to design services tailored to their needs, like the website MindMate, which contains a wealth of material about mental health issues, created by young people for young people.
Because it's written by young people, you know that there are other young people even in your city or region that are going through the exact same things you are.
We've really involved in the design, the output and the input as well.
One of the things that we really wanted to do was to develop the digital resources in the city. We had very strong feedback that that could be a good way of connecting with the young people and responding to them. So we worked to collect a group of young people together, and we had a hack day. So website developers came along and worked alongside the young people and ourselves, and that informed what we needed on our website.
Digital technology plays a key role in creating a better service for Leeds CCG patients. At the Street Lane practice, they've managed to reduce dermatology hospital referrals by 70% using technology that allows specialist GPs to provide their expertise for colleagues.
The referring GP would take a photograph on the device, attach it to the medical records, it would be sent through to me and I would see the photograph. With access to the medical records, I could look at the background history, make a diagnosis, give the GP a treatment plan, send it back to the GP within 2 working days so they could contact the patient. The patient would then have a diagnosis and treatment much quicker than if they'd been referred to the hospital, waiting the usual 13 weeks to be seen by a consultant.
Here in Leeds we have the Leeds Care Record, which helps to connect all the different professionals across the health and social care sector.
At Leeds CCG, digital technology not only plays a key role in creating better relationships between medical staff and patients, but also between fellow professionals too.
Professionals can communicate more easily, they can see each other's records, they have access to where the different specialties are thinking and what they're doing with patient care very, very quickly, just at their fingertips. We in Leeds have managed to achieve something really, really good that's being used hugely by an enormous number of our health professionals.
Whatever the age of the patient, NHS Leeds CCG is committed to listening to them to form better relationships, using digital innovation to provide a first-class service which the patients themselves have helped to design.